Hello, I'm Zita Powell, representing the African American Health Disparities Council, AAHD for short. You may be wondering, what is a disparity? Well, it is a significant difference or gap in outcomes between groups, and it is clear that there are gaps in health outcomes experienced by communities of color. The AAHD was formed by Metro Health's Healthy Start and Health Equity programs in 2017 to create a bridge between Black communities, public health professionals, and healthcare providers. The AAHD seeks to bring community voice and life experiences to discussions about health issues that impact San Antonio's Black residents. For instance, did you know that even if you control for things like education level and annual income, Black moms and babies still die at a higher rate or have more pregnancy and birth complications than white peers? These were some of the first questions that the AAHD explored with community chats and panel discussions, and we have not stopped there. The impact of bias within systems and racism throughout generations is something that we need to keep talking about and finding solutions for. The Council has looked at bias in the healthcare system and the many facets of trauma that our community is currently dealing with. The COVID-19 pandemic also offers a unique opportunity to listen to Black residents and to promote prevention, healing, and elimination of barriers. Please join us for our Real Talk with Real Providers series hosted by the AAHD Council and the Well Women, Well Communities Action Board. We hope you like hearing about health issues from healthcare professionals who live and serve in San Antonio, and we want to hear from you. To learn more about AAHD, including how to join the council, or to submit questions for providers about health problems you feel are affecting our community, please email aahdcouncil@gmail.com. You can also scan the QR code on your screen to submit a provider question or share issues you think are important to focus on in your neighborhood. If you need information about COVID-19, please visit the City of San Antonio's COVID-19 homepage at covid19.sanantonio.gov. Thank you. Dr. Allison Waridibo, a fellow of the American College of Physicians, MD, is an assistant professor of infectious disease with UT Health San Antonio and serves as the medical director for the San Antonio AIDS Foundation.
Well, the reason to get the vaccine is that it does a lot more than just prevent you from getting COVID-19 infection. You can still get COVID-19 infection if you get vaccinated, but the vaccine reduces your chances of transmitting the virus to somebody else. Also, if you are vaccinated and you get COVID-19 infection, it prevents you from getting serious illness, it prevents you from hospitalization, and most importantly, it significantly reduces the chance of you dying from COVID-19 infection. And so those are really the reasons why you should get the COVID-19 vaccine.
Dr. Ruka Warame is an infectious disease MD fellow with UT Health Science Center, San Antonio.
So why should you get the vaccine? The vaccine is the one way we can safely build protection against the virus. By getting the vaccine, we can protect ourselves and prevent the spread of COVID-19 in our neighborhoods and our communities. Is the COVID vaccine safe? Yes. It is safe and it works. The two main things that are tested for before vaccines are approved for use is if it is safe and it works. And this vaccine has passed both of those tests. It's been over a year since the approval of this vaccine for trials. And so far, over 145 million people in the United States have been vaccinated. Over 45% of people in this country have been vaccinated. And the vaccine is still proven to be safe and effective.
Dr. Allison Waridibo, a fellow of the American College of Physicians, MD, is an assistant professor of infectious disease with UT Health San Antonio and serves as the medical director for the San Antonio AIDS Foundation.
The best brand to get is really the one that is first available to you. There are 3 brands of COVID-19 vaccine available in the United States, and all of them significantly reduce your chances of dying from COVID-19 infection, and that is really the great equalizer among all 3. They're all different, so for example, 2 of them require 2 shots for full protection, and 1 of them requires 1 shot for full protection. And they all have varying efficacy in the populations they were studied in preventing you from getting COVID-19 infection. But I think the most important thing to remember is that all 3 of them significantly reduce your chances of dying from COVID-19 infection.
Dr. Derek Young is Senior Medical Director for WellMed Medical.
Hi, I am Dr. Derek Young. Question: will the vaccine make me sick? The vaccine may cause some side effects. The vaccine will not cause you to be sick from COVID-19 or give you COVID-19. Some of the more common side effects are fatigue, muscle pain, headache, fever, nausea, and redness, pain, or swelling at the injection site. These side effects are a sign of a strong immune system. Your body is learning how to protect you from COVID-19. These symptoms typically occur within 2 days of your shot, may vary in how much you feel them, and typically resolve within 1 to 2 days after they start.
Dr. Ruka Warame is an infectious disease MD fellow with UT Health Science Center San Antonio.
Will the vaccine make you sick? After getting the vaccine, you may have some side effects, and it's normal. It's your body building protection against the infection. Some people might have a redness and swelling and even some pain in their arm at the injection site. Some people, especially those younger than the age of 55, might have fever, chills, fatigue, and those are they're short lasting. They last for about 1 to 3 days. But majority of people have no symptoms.
Dr. Derek Young is Senior Medical Director for WellMed Medical.
Hi, I am Dr. Derek Young. Question: if I have had COVID-19, should I still be vaccinated? Yes, you should still be vaccinated. We know people will have some level of natural immunity after they are sick with COVID-19. We do not know how long that immunity will last. You can receive a COVID-19 vaccine as soon as your isolation period has ended. If you receive treatment for COVID-19 with convalescent plasma or monoclonal antibodies, you would need to wait 90 days before you can receive a COVID-19 vaccine.
Dr. Ruka Warame is an infectious disease MD fellow with UT Health Science Center San Antonio.
So if you've gotten COVID-19 infection, should you still get the vaccine? Yes, you should. The CDC recommends that those who had COVID-19 still get COVID-19 infection still get the vaccine. And this is because after getting an infection, we just don't know how long and how well you're protected from getting it again. Now, experts and ongoing studies are trying to figure out how long you're protected after getting the vaccine. What we know so far is that you're protected for a longer period of time after you get the vaccine.
Dr. Jasmine Aldridge holds a Master of Public Health and is the resident MD with Family and Community Medicine at UT Health Science Center at San Antonio.
Hello everyone, my name is Dr. Jasmine Aldridge and I am a family medicine resident physician here in San Antonio. Why would people continue to wear a mask even after they have been vaccinated? So let's look at what happens when you're initially vaccinated. Your body is developing that spike protein that encapsulates or surrounds the virus in order to learn how to recognize that protein and fight it off. It takes some days for your immune system to learn how to do this. Therefore, in those first initial days after you've received your first shot, you're not actually fully ready to recognize and fight against that protein that encapsulates or surrounds that virus. Therefore, it would behoove you and those around you to continue to wear a mask in order to protect yourselves from continuing to allow the virus to circulate between you. Similarly, even after you've been fully vaccinated and you have those appropriate antibodies, you still might have friends or family who have not been vaccinated. Therefore, you could still receive the coronavirus, not know that you have it, and pass it on to someone else who is not vaccinated. Similarly, others who have not been vaccinated could still transmit the virus to you, even though you may not show up with as many symptoms. It might be asymptomatic, as we say. So this is how the virus continues to circulate in our communities and continues the pandemic. Now, to the second part of the question, should we continue to practice social distancing guidelines even after we've been vaccinated? My answer would be yes, for the reasons I've already mentioned. You don't know who amongst you or around you has not been vaccinated, or in some cases you wouldn't know which friends and family members have not yet received their vaccine. For that same reason, it's appropriate to practice the distancing of like 6 feet apart, and also continue washing of hands and those practices that we all got used to in 2020. These are practices that are just going to help our overall health as a community in general.
Dr. Derek Young is Senior Medical Director for WellMed Medical.
Hi, I am Dr. Derek Young. Question: can I get COVID-19 again? The short answer is yes, you can get COVID-19 again. However, it is rare to see reinfection soon after an initial infection. Most people will not experience a reinfection within 3 months or possibly up to 6 months or more. We are still learning about the virus and how the different variants may impact reinfection. Our immune response, the amount of virus to which you are exposed, the length of time between infections, and your current health status all play a role in potential reinfection.
Dr. Jasmine Aldridge holds a Master of Public Health and is the resident MD with Family and Community Medicine at UT Health Science Center at San Antonio.
Hello everyone, my name is Dr. Jasmine Aldridge and I am a family medicine resident physician here in San Antonio. I want to talk about the next step, getting beyond this pandemic. What's going to help us do that is herd immunity. That's a concept where so many people within a community are vaccinated that they become immune to the disease that's circulating, to the point where the disease no longer circulates because it has no person to go and infect, because everyone has antibodies against it. It has been estimated that it would take about 75 to 80% of Americans to be vaccinated in order for this to happen with the coronavirus. Those were my suggestions and insights based on my experience and research. I hope it's been helpful.
Charlotte Davis is a licensed vocational nurse and is the founder, president, and CEO of Black Nurses Rock San Antonio chapter.
Before and after getting the COVID-19 vaccine, most medical procedures may be performed. There are some things to think about if you are due for your mammogram and have recently been vaccinated. Some people who have received the COVID-19 vaccine have had some swelling in the lymph nodes under the arm near where they received the vaccine. This type of swelling is a normal sign that the body is building a protection against COVID-19. This is a good thing. However, it could cause a false reading on your mammogram. The CDC suggests that you get your mammogram before being vaccinated, or that you wait 4 to 6 weeks after receiving the vaccination. If you have any other questions or concerns, please contact your primary care provider and ask them how long you should wait before getting your mammogram. Please still get your mammogram if you are due. According to the Center for Disease Control and Protection, or CDC, current studies suggest that breast milk is not likely to spread the virus to babies. After all, breast milk is the best source of nutrients for babies. Even better, breast milk provides the best protection against many illnesses. We have also seen that some mothers have passed antibiotics to their babies during the third trimester. That is month 7 to month 9 of the pregnancies. These antibiotics could help protect the babies after birth. Finally, we know that the COVID-19 mRNA vaccines, such as Pfizer and Moderna, do not interact with a person's DNA or cause any changes to a person's genes. If you have COVID-19 and you choose to breastfeed, you should wash your hands with soap and water for 20 seconds before breastfeeding or expressing breast milk, and even if you don't have COVID-19. If soap and water is not available, you may use hand sanitizer with at least 60% alcohol. Also wear a mask while breastfeeding and whenever you are within 6 feet of your baby. If you have any questions or concern, you should speak to your doctor or lactation consultant about the benefits of breastfeeding and the risks for transmitting the virus.
We hope you like hearing about health issues from healthcare professionals who live and serve in San Antonio, and we want to hear from you. To learn more about AAHD, including how to join the council or to submit questions for providers about health problems you feel are affecting our community, please email aahdcouncil@gmail.com. You can also scan the QR code on your screen to submit a provider question or share issues you think are important to focus on in your neighborhood. If you need information about COVID-19, please visit the City of San Antonio's COVID-19 homepage at covid19.sanantonio.gov. Thank you.